Abbott Vascular Devices presents the Perclose AT Vascular Closure System. The Perclose AT, or Auto Tie, is a 6 French device that's designed to automatically tie a clinch knot and place it in the tissue tract just above the artery. It features 2 stainless steel needles, 1 color-coded braided polyester suture, and a fully formed manufactured knot that is housed inside the proximal guide of the device so that it can be placed subcutaneously close to the arteriotomy. The knot is formed by placing the knot wraps on a tube around the solid anterior needle. The posterior needle is hollow and is also housed in the proximal guide. Inserted into the posterior needle is a detachable posterior needle tip. Bonded to the posterior needle tip is one end of the suture, the rail portion, which is colored green. The non-rail portion of the suture is colored white. The suture is entirely stored in the proximal guide and handle of the device. Once the device is properly positioned in the femoral artery, the foot is deployed from the guide by pulling the lever back. Inside the foot are 2 cuffs, the anterior cuff and the posterior cuff. Connecting the 2 cuffs is the link, a Teflon filament approximately 1 1/2 inches long, which is stored in the suture bearing area near the foot. Pushing on the plunger of the handle deploys the 2 needles through the artery wall and into the cuffs. The anterior needle captures the anterior cuff, while the posterior needle tip captures the posterior cuff, connecting the rail suture to the link. The anterior needle drives the anterior cuff partially through the bottom of the foot. The posterior needle tip and posterior cuff are driven completely through the bottom of the foot and detach from the posterior needle. When the needles are retracted, the anterior needle pulls the link and rail suture along with it, up through the artery wall and through the knot, looping the suture around the arteriotomy and completing the auto knot. After the foot is retracted and the device removed, the auto knot is tightened to achieve hemostasis and complete the procedure. The proximal guide houses the knot and needles and receives the rail suture after it is pulled through the artery wall. The distal guide houses the foot and precisely controls the placement of the needles around the puncture site. The marker port is positioned in the proximal guide, providing a pathway for arterial bleeding into the dedicated marker lumen located in the proximal end of the device. A steady, continuous drip of blood from the dedicated marker lumen occurs when the foot is intraluminal. The lever deploys and parks the foot. The needle plunger deploys and retracts the 2 stainless steel needles. Suture storage lumens allow the suture to be stored in the guide and body of the device rather than in the sheath. The sheath is designed to track over a standard 38,000th-inch guide wire in a manner similar to an introducer sheath. The guide wire exit port permits removal and reintroduction of the guide wire. The Perclose AT Vascular Closure System. Abbott Vascular Devices.